Hi everyone, my name is Mrunal Shah. I'm one of the primary care physicians practicing in Hudson, Florida for the last 6 years. I've been practicing medicine for the last 11 years and myself and my family moved to Florida about 6 years ago, and I've been in Hudson since then. Today I wanted to talk to everyone about cardiovascular disease and how important it is to know. And the main reason I wanted to talk to you about it is because, as many of you guys know, is that cardiovascular disease is the #1 cause of death in men and women in the United States. Today I'll be talking about how I, as a primary care physician, and how we as primary care physician family can help our patients reduce the risk factors of cardiovascular disease. So today I'll be going into little detail about each risk factors and how I can help my patients control these risk factors. So in my practice, we get about 2 different kinds of patients. Ones who've already developed cardiovascular disease, and the other ones that haven't developed it, but they have the risk factors. So let me start off by explaining you guys all the risk factors that are involved in the cardiovascular disease. So I always like to use my fist to explain the 5 risk factors with my patients. The one is hypertension, the second one is diabetes, the third one is high cholesterol, the fourth one is smoking, and the fifth one is obesity. The sixth one is family history. Unfortunately, we don't have a lot of control over our family history, but I'll try to bring it in and how I can tie it together. So let's talk about each risk factors and how we can control those risk factors. So first of all, you have to understand that as more risk factors you have, more probability you have of you having the cardiovascular disease. And the less risk factors you have, you minimize it. Now, the other thing is also that if you do have the risk factors, you want to control it. So let's talk about them. First one is hypertension. And many of you guys know hypertension is a big killer. And is one of the major risk factors for cardiovascular disease. Patients come to me all the time, and you sit down with them and you explain to them that how important it is. Many of the people don't even realize that eating salt is bad for you. You sit down with them, you explain to them that all the food that you're consuming has salt in it. Once they're able to modify their diet, their blood pressure comes down right away. Another thing is, many studies have shown that every 2 pounds you lose, you decrease the blood pressure by 1 point. And I've had many patients in the past that they've taken that approach of losing weight and controlling their blood pressure, and they've taken themselves off the blood pressure medications after a few months. So again, hypertension is one of the big risk factors, and by controlling it, you're minimizing the risk factor itself for the cardiovascular disease. The second one, diabetes. I know everybody knows diabetes. So my approach to diabetes may be a little bit different than some of the other primary care physicians. We do fasting glucose levels or hemoglobin A1C to diagnose diabetes, but it doesn't stop there. It's very easy for primary care physicians to just write a prescription. What I try to do is I sit down with my patient, I try to find out what they're eating, what they're not eating, what they should be eating and what they shouldn't be eating, and then educate them. And this education goes a long way with these patients. And when they do follow the recommendations, when they do change their diet, when they do lose weight, all of a sudden their sugars are down and they don't even need medication. Now, if they do need the medication, you sit down and you explain to them how the medication should be taken, how often the blood sugars should be checked, and what to eat and what not to eat. So diabetes, again, is one of the major risk factors. If you put all the 5 risk factors together, that gives you about 90%. And if you can reduce the risk factors, then again, you're gonna be really ahead of the game. Then the next one is high cholesterol. So in high cholesterol, genetics do play a role, but patients don't know that. You won't know that until you change your diet with high cholesterol. So again, many doctors, when they see that you have high cholesterol, their knee-jerk reaction is to start them on a cholesterol medication. But again, I like to sit with my patients, I like to talk to them, and get into their daily life routine and see what they consume. They may not even realize that what they're consuming is causing high cholesterol. So to sit down with them and explain to them what they're eating that's causing the high cholesterol goes a long way. And my approach to high cholesterol is a little bit different. So if you come into my office and I find out that you have high cholesterol, I go up line by line and try and explain to you why your cholesterol is high and how your cholesterol is high. Then you come up with a plan for the next 3 months. This is the kind of food you're going to eat. You're going to try to lose weight. You're going to exercise in about 3 months, 4 months. If you're able to bring down your cholesterol and if you can maintain it there, then you got yourself an answer, and you'll be staying away from taking another medication or a medication. So elevated cholesterol is probably one of the highest risk factors for cardiovascular disease, and it's very, very important to control that risk factors. And the last 2 risk factors I wanted to talk to you guys about was the obesity and the smoking. So people come into my office all the time, and I think as a primary care physician, this is one of the hardest things that I have to do, to have my patients stop smoking. It's extremely, extremely hard. There's so many variables that go into helping my patients stop smoking. You know, their loved ones that they are smoking. So when they decide to quit, if their husband or wife, they're smoking, it's really, really, really tough for them to stop. So how many times patients come into my office, and if I ask them if they've tried to stop smoking, they say, "Oh yeah, doc, I've tried to stop smoking all the time." But then when you try to ask more questions, you realize that they're not really doing it properly. To kind of give you guys an example, I have patients coming into my office all the time, and you ask them, "How much do you smoke?" And they say 1 to 2 packs of cigarettes a day. And that's usually the normal. Now, then you ask them what they've tried, and they said they've tried a patch. Well, it's not going to work. People have to realize that amount of nicotine that is in a nicotine patch is only 21 micrograms, which means that only for the people who smoke about 8 to 10 cigarettes a day. So if you're used to smoking 1 to 2 packs of cigarettes a day, that's not enough nicotine for you, and you're going to end up picking up that packet of cigarettes and start smoking again. So education is key, and start trying to smoke. Now, if you do want to use the nicotine pads as the avenue of stop smoking, then you have to use your willpower, and little by little you have to bring it down to 8 to 10 cigarettes a day, and then you have to stop smoking at that point, and then your outcome will be much better. Of course, there are other medications that you can use to stop smoking. There are 2 FDA approved medications, and myself or your primary care physician can talk to you about that. So the last risk factor that I wanted to talk to you about is obesity. I get very passionate when I talk about weight loss with my patient, because not only that I preach it, I also practice it. So a lot of people come into my office, they always tell me that, "Doc, I am exercising, I am not losing weight, can you help me?" Well, first of all, I take a step back and I try to figure out what they're doing wrong in their life. Or if they're doing something right, you try to say that you are doing something right and you keep it up. There are 2 portions of obesity. There's diet and there's exercise. So, and then people come to me all the time and say, they tell me, "Doc, what's the best diet? What's the best diet?" Well, my answer is always, there is no great diet. It's called common sense diet. And after a certain age, we all know what to eat and what not to eat. So you should know what you're putting in your body. So I try not to tell them that the Mediterranean diet is good, or the latest and the greatest, the keto diet is good. I try not to tell them that, because what happens with those diets is that they only last for a few months, maybe a year, but changing your diet is a lifestyle modification. And it is a state of mind that you have to change. You have to change your lifestyle for it. So again, I always like to explain the diet as a common sense diet. You should know what you're putting in your body. The other portion of losing weight, and this is what I get very, very passionate about, is that they come to me all the time, the patients come to me all the time, and they said, "Doc, I'm walking 5 miles a day, but I'm not losing weight." Well, it's great that you're walking 5 miles a day. It's being active, but it's not really getting to the purpose of to what you're trying to accomplish. What you're trying to accomplish is that you're trying to lose weight. So what I always tell my patients is that yeah, you're walking 5 miles a day, but you're not really burning calories. So I like to just give a very simple example. Let's say you're consuming 2,000 calories in a day. Well, if you're consuming 2,000 calories in a day and you're only burning 1,500 calories in a day, the extra 500 will turn into a fat and you'll gain weight. Well, if you're burning 2,500 calories, then that extra 500 calories, then you're going to end up losing weight. So what people just don't realize how to lose that extra 500 calories. And the most important way to lose weight is increasing your heart rate. And this is the key. This is the key. You want to maximize your heart rate. You have to sit down with your doctor and you have to figure out if your heart is in good enough condition to increase your heart rate. Once you do that, you have to realize, based on your age, you have a maximum heart rate. And more time you spend maximizing your heart rate, and more time you spend in the heart rate of 120s, 130s, 140s, depending on what your maximum heart rate, that's where you're going to get the benefit. Not when you're walking 5 miles a day and your heart rate getting up to 90, 100. People just don't realize that. So it's very, very, very important for you to increase your heart rate into the 130s, 140s if you're trying to lose weight. If you're trying to be active, that's a different story. So again, I wanted to recapture all these 5 points, the 5 risk factors. Again, how important it is to control these risk factors. More risk factors you have, higher the chances of you getting cardiovascular disease. But if you do have the risk factors, with a little bit of a knowledge and a help from your primary care physician, you can modify it, you can control it, and you can minimize the risk factors for your cardiovascular disease in the future. Have a nice day. Thank you.